why are we here?
We're here to see the doctor. You've been having a lot of weird symptoms lately, don't you remember?
Hello. Hi, Mrs. Baines. Nice to meet you. You must be Tamron. Nice to meet you. I'm Dr. Abbasi. Just tell me a little bit about what brought you in today.
My shoulder's burning. Having trouble walking, which is weird because I'm generally pretty fit.
She's also been having a lot of headaches and memory issues, and she's been feeling very nauseated and depressed. She's withdrawing too from everyone.
Is no one going to mention the dragon?
She's also been having terrible hallucinations, as you can tell. I tried Googling the symptoms, and I think it might be encephalitis.
Well, first of all, I'm terribly sorry to hear about all of these symptoms. Let's not jump straight away to encephalitis. We'll definitely see if that could be a possible cause. I think we should maybe start with asking some more preliminary questions. So maybe if it's okay with you guys, I can get a little bit more patient history on Tamron, okay? Hey there, Dr. Chan, how's it going? I have a really interesting patient exhibiting symptoms of nausea, headaches, slurred vision, and a bunch of stuff. But I was thinking about all the different things it could be, and I wanted to get a little bit of a second opinion. I just inputted my notes into the patient's chart. Feel free to check that up with me so we can look through these symptoms together.
Sure. Let me go ahead and find her chart first.
Yeah.
Okay, looks like I just found it. And it seems like the patient's condition rapidly worsened within the first few weeks since she started exhibiting symptoms.
Yes.
She doesn't seem to have any flu-like symptoms like no fever, sore throat, sneezing, etc. So we can probably rule out infections that follow that trend. I'm assuming it's not a common cold or even an STI.
Right, and something else I noticed while I was in the room with the patient was that a lot of her symptoms are purely neurological or psychological in manner. She didn't have any sort of distinct epithelial abnormalities or any sort of fatigue or diarrhea.
Okay, well based on that, probably not a skin disorder, not gastrointestinal, cardiovascular or lymph, or even genitourinary infection.
None of that.
So we can focus on infections of the nervous system since you mentioned neurological symptoms.
I agree.
I mean, given her age, it says she's 40, it's possible that she has early Alzheimer's. I mean, hallucinations, depression, impaired memory, difficulty walking, those seem to match pretty well with early Alzheimer's.
Yeah, you know, now that you mention that, I'm thinking it could possibly be a form of encephalitis. I mean, the patient's mother kind of brought it up and I kind of brushed it off in the beginning, but it is a common disorder and the symptoms and the signs match quite well. However, it does usually cause fever and a sore throat, and that is obviously not happening with our patient here today.
I mean, even if she's not displaying fever, it's possible that she just has a mild form of encephalitis and doesn't have fever. So if it's a not severe case and she just has a milder form of encephalitis, we would have to consider the different pathogens that could have caused it. So one would be rabies and the other would be poliovirus.
You mentioned polio, but doesn't polio usually result in muscle atrophy? Since muscle atrophy is such a distinct characteristic of polio, I'm not sure if it would be a plausible choice here.
I mean, I think you might be referring to a severe case of poliovirus. Acute cases usually result in very mild symptoms like headache, nausea, etc. So considering the conditions that your patient is experiencing, it's possible that she just has the acute version of poliovirus.
Yeah, there's just so many different tests you might have to go through if we did that.
Let me just look at her chart again.
Yes, feel free to look at all the notes I put in.
Could it be fungal meningitis? I mean, it causes headache, nausea, confusion, changes in behavior. All of those match with your patient. The only thing is that it's kind of similar to what you brought up with encephalitis. It results in fever, but your patient doesn't have fever.
Right. I mean, it does seem reasonable if we apply the same reasoning you stated before, that the patient would just have a mild case of meningitis, but not all patients will exhibit the same exact symptoms that are statistically prevalent in the general public. So it's a hard call.
You bring up a very good point. There's something that I am considering, but I don't know how reasonable it would be.
Okay, Amy, spit it out. What are you thinking, Dr. Chan?
Well, it's really, really rare,
Mhm.
but have you heard of variant Creutzfeldt-Jakob disease?
Explain.
Well, it's more of like the variant of Creutzfeldt-Jakob disease. It's a type of prion disease that can severely impact neurological and physiological and psychological functions. So your patient who's experiencing neurological damage or neurological symptoms and behavioral changes, those align really well with variant CJD. So if it's this disease, her health would rapidly deteriorate within the next year or so. What you could do, because this is so rare, is just ask her a few guiding questions to see if you can rule this disease out from your list of potential candidates.
You know, it's an interesting call, but it is a very rare disease, seeing that it only affects 1 in every so million people every so often each year. So yes, I guess we could look into that. We could say that her symptoms align with very early variant Creutzfeldt-Jakob disease, but I highly doubt that's the case, just because this disease is so rare. You know what? I'll jot it down in my notes along with her vitals, and I'll get back to you soon. Thank you, Dr.
Sounds
Chan.
good.
Alrighty.